Okay, we're here today with Bob McFarlane, and Bob's going to tell us a little bit about his experience with his care at our office. So, Bob, can I ask you, what was the condition or problems that brought you to our office?
Well, I've had chronic issues through the years: shoulders, back, low back, hip, and progressive with my shoulders, I guess, where they've gotten stiffer with age. And
Right.
I've had chiropractic adjustments. I've had massage therapy. I have a hot tub at home.
Right.
And
So
so I've struggled with this through the years.
right, you've had these things for quite a while prior to coming in here, certainly.
Yes.
And so we've identified this is not a recent thing or new condition, but you've been trying to deal with this on your own. Had you seen other doctors at all? Other physicians?
I've had therapy through my medical physician, and that was moderately effective, but not curative. And
Right.
so I take muscle relaxants and other additives and whatever I can do to ease the not just the pain, but the limit of range I've got with reaching overhead, and that's seemingly gotten worse over time as with my age as well.
Right. So at its worst, what was it like? I mean, when you really were having
Trouble sleeping, only a couple positions where I was comfortable in bed, and reaching overhead, I have to struggle with that.
Right.
Try to do exercises to increase that range, but it's hard to get my arms up over my head or to reach behind me. When I put a belt on, I have to string the belt through the loops before I put the slacks on, or the shorts on, because I can't reach all the way around.
Right, to get the belt. So it was really affecting your ability to perform some basic activities. What did you do to change it? I mean, what have you done differently?
Well, more recently, the Pulsed Electro Magnetic Therapy seems to be pretty effective. It's
Right.
gets in deep. I'm
Yeah.
large. I'm about 300 pounds and 6'4", so thick shoulders, and it seems to really get in deeply to the center of
Penetrate.
the problem. Penetrates in. Same with the hip, and I can feel it working at the base of those large muscle groups, where it seems to give me quite a bit of relief.
Well, that's what we've noticed. I'd even ask you if you wouldn't mind just show if you could, the ability to raise your arm, just kind of looking here.
That's much better than I was. I can get up. It's still a struggle, but
it's not perfect by any means, and I certainly recall in the early days, that limited range of motion and the pain you had while doing that, certainly. So, do you feel like you're able to do things better now, or your ability to perform some activities?
I feel freer, especially after I have a treatment. When I leave here, I'm walking much less restricted, I should say. And I've had a number of these. I've had a trial, and then I've had 5 more, I guess 7 altogether. And it seems like that's over a couple months.
Yeah,
and
it's been spread out.
It seems like it's gotten progressively better with that.
Yeah, I think it's helped. I mean, I've seen the improvements with your chiropractic adjustments, and I think the combination seems to be working well. What would you suggest to others, or would you recommend this to anybody
else?
else?
I would say try it. Not only the trial, but I jumped right in for the package of 5. It's a little bit better pricing, and
right.
It seemed to, like I say, be progressively helpful. Not just the first 1 or 2. I could tell before I bought the package of 5. I could tell it was going to
help you out,
help more. So I think it has.
Right. Well, that's great, and I really want to thank you again for sharing your information with us today, and hopefully others will at least know that
it's there.
They're not alone.
Yeah, it's another. I guess the modality would be the term, but it's been beneficial for me, and I plan to do more of them.
That's great. As I said, this device has been a real plus for a number of patients. We've seen people with heel spurs improve, bone healing. One patient wasn't able to have the fracture in her leg wasn't healing, and that's been improving. So a number of professional athletes are using it, and other sports teams are incorporating it, and we're just glad we can offer it to patients. So,
Good.
well, thank you, sir.
Okay.